This is Dr. Frezza at the Chiropractic and Injury Center. Today we're going to be talking about the traction table. Traction table is very important at the office. It is part of our care plan. We utilize it during the third month. In the third month of care, what we're looking to do is we're looking to try to stabilize the joint. We want to get those bones to move back into position, but we want to get them to stay there. And the only way that we can do that is by getting the ligaments to strengthen. That's why we use the traction table. There are two main reasons, two things that we want to focus on with the traction table. The first thing is we want to stretch the musculature, right? And you can see the traction table here on Susan. It's going up and it's going down, and it's taking her muscles and it's stretching them. That's what most people think when they think of the traction table. But the other thing that it does that's even more important is it strengthens the ligament. The way ligaments work is you can't strengthen them like you can a muscle. Right? Think about doing a bicep curl. Okay, when you do a bicep curl, you're strengthening your muscle. That's not how ligaments strengthen. The only way to strengthen a ligament is to stretch it. Because as you stretch a ligament, when it snaps back stronger. And that's what we want. So the way the traction table is working is it's stretching those muscles in there, but it's also stretching those ligaments and it's strengthening them, okay? And that's important because when we get to the last part of our care plan, we want to lock those segments in their proper position. And that's what we're doing when we're strengthening those ligaments. The second reason that we do it has to do with the discs. Okay, we had done a video a couple of back where we looked and we saw how discs can begin to thin as they degenerate. When that happens, you lose blood supply to the disc. Actually, after the age of about 26 or 27, just when people begin to age, you lose blood supply to the disc. So think of it almost like a flower that you fail to water and it's beginning to wilt, okay? The second important thing that the traction table does is it increases the blood supply to the disc. So it's like taking that flower that's wilting and it's adding water to it. So when we increase the blood supply, again, it enables us to stabilize these areas. And that's the important aspect of the third part of our care plan. Person's already feeling better. We want to get their bones to change, their spinal segments locked in position, and we want to increase that mobility and that blood supply to the disc. And like I said, the traction table does a really good job of doing that. This is Dr. Frezza. Thanks for watching.